We're good? All right. Woo, woo. All right, let us get started. Woo, woo. Good morning.
Good morning.
My name is Minister Janae Bates, and I am the co-executive director of Isaiah. And I am here today, along with clergy across this state from many different faith traditions, Christian, Jewish, Muslim, Buddhist, who are all standing here together, saying that it is time, it is beyond time, that we ensure that we are doing all we can to care for our people. Amen. Right now, we are on a clock. Our Congress people are on a clock. And that clock is ticking down to September 30th, where they are called to make a decision on if they are going to care for the Americans in this country, if they are going to care and make sure that we have the kind of health care that we need to thrive. Yes. They are also making a decision on if they are going to funnel, instead of caring for our bodies, if they're going to funnel billions of dollars into billionaires' pockets through tax cuts. Whoa. They have already passed the most expensive bill that this country has ever seen. Boo! Boo! Yeah. Because that bill was not a bill that was spent to pay for our health care. No. It was not spent to pay for our elder care and our child care and our food programs and our education. That is a justifiable way to spend our funds. Yes. But instead, they chose to spend those funds to disappear people from our country. And they chose to spend those funds to cut our food sources. And they chose to spend those funds to give billionaires more billions. And so as people of moral courage, we stand here and say no. No. And we get to stand here with our congressperson, our U.S. Senator Tina Smith, who is standing here with us, who is excited with us, and who is willing to fight to make sure that every single person in this country has what they need. Amen. And so the call today is for our congressional people across this nation, but most certainly in this state, to stand with us and to fight for us. Amen. We are under no delusion. We know that there are 4 Republican congresspeople, even here in this state, who voted for that horrific bill. And had the nerve to call it beautiful. We will not believe the lies. We know when something is very ugly and when it actually can kill us. And so we're here with stories from clergy, and we're here with our congresswoman calling on our congresspeople to do the right thing, to stand up and fight for us, to fight for our health care, to fight for our children, to fight for our neighbors. Yes. Now is the time. Yes. And I would like to first introduce our amazing Congresswoman, U.S. Senator Tina Smith.
Well, thank you. Thank you. Good morning, everyone. Good morning. And thank you so much, Minister Bates, for your commitment to putting faith into action in exactly this way. And thank you to Isaiah and all of the faith leaders and community leaders standing behind me who are committed in all of your work to make this a better, safer, and more humane world for all of us. You give me such hope. So we are here because we see that over the last 9 months, Donald Trump and Republicans in Congress have made it harder for Minnesotans to afford their lives. Costs are up for everything, coffee, beef, you name it, costs are going up. And at the same time, they have cut support for nutrition programs, for schools, and for life-saving medical research to find the cures for cancer and Alzheimer's. And We have ICE agents with masks over their faces swooping into neighborhoods and taking people away with no due process, all at the same time that businesses and communities are struggling to find good people to work with them. This administration is lawless. It is corrupt. It is bullying, and it is ignoring our values around due process and around free speech. As part of this rampage, Republicans in Congress and Donald Trump are gutting our health care. In their so-called one big beautiful bill, they took billions away from rural hospitals and are kicking millions of Americans off of their health insurance. And I can tell you, I've talked to rural hospitals. Many of the clergy standing behind me come from small towns and rural places in this state. I have talked to rural hospitals who have told me that because of these cuts to Medicaid, they may be forced to close their doors. And trust me, this is something that affects everybody in our communities, not just those of us that rely on medical assistance to get access to the health care that we need.
That's right.
Trump's tariffs have driven up the cost for all of the medical supplies that we need, and that is driving up healthcare costs. And now Minnesotans are looking at skyrocketing healthcare premiums for this next year, up to 70% increases in some of the worst cases. So no matter how you get your insurance or who your doctor is, you are going to feel this in your very own pocketbook. Now,
Preach, sister.
next week, Congress is facing a big deadline to pass the federal budget. And Republicans, let's remember this, Republicans are in charge of the White House. They are in charge of the Senate. They are in charge of the United States House of Representatives. And now, after failing to get their work done on time, after failing completely to work with Democrats, they're refusing to work with us and are on a path to shut down the government. And let's be clear, Republicans are in charge, so this mess is their mess. Donald Trump refuses to even meet with Democrats. And in fact, the House Republicans adjourned and aren't even planning on being back in Washington, D.C. until early October. That shows how much they think about the voices here in Minnesota and every place around this country. And I want to be really clear to Minnesotans. While Democrats may not be in power, we are not powerless in this moment. And I am ready to work with anyone who wants to work with me to lower health care premiums, to restore life-saving medical research, and to help Minnesotans afford their health care and their lives. But I also want to be really clear, I will not be bullied. I will not be intimidated by this lawless administration. Republicans and Donald Trump have spent the last year rigging this economy to benefit the wealthiest Americans, the biggest billionaires, and the biggest corporations. And now Minnesotans are literally paying the price for that. We are literally paying the price for that in everything, especially and including health care. And so, if they refuse to work with us, if they refuse to consider what we want to do to make life better for our constituents, they need to understand that I am not going to support their work to make life worse for Minnesotans. I am not going to help them hurt my constituents. If they decide that they're going to do this, if they're going to go down on this path all on their own, then they are welcome to it, but I will not help them do it. So we need to stand strong together, Minnesota. Yes. We need to stand strong together. Behind me, there are people with so much power in their communities. And right now, this administration wants us to think that we are powerless, that there is nothing that we can do, that our job is just to go along. But we are not going to be intimidated. We will not be bullied. We will continue to fight for the things that make our communities wonderful and healthy and alive, and that is why we are standing with all of you today. So thank you so much to all of you faith leaders for your work, standing up for our democracy and standing up for health care for everybody in this state. Thank you so much, everyone.
Thank you so much. Thank you so much, Senator Smith. Next, we are going to hear from Pastor Isaiah Dennis.
Morning, everybody.
Morning.
First, I want to give honor to everybody who's here, from elected officials, community leaders, faith leaders, advocates, and members of the press gathered here today, standing on the side of life, dignity, and justice. To introduce myself, again, my name is Pastor Isaiah Dennis, and on October 31st, it will mark 8 years since I've been diagnosed with HIV. Since then, my life has been dependent on daily medication that costs more than $4,800 a month. And it's because of Medicaid I'm still standing here today. Because without it, I would have had to choose between bankruptcy or death. But one of the things that I'm reminded of is the prophet Micah, who says this: "What does the Lord require of you but to do justice, to love mercy, and walk humbly with your God?" Protecting health care is an act of justice and mercy. The choices our leaders make will determine whether people will live or die. And this is not just my story. Across Minnesota and across the country, those who are living with HIV, cancer, diabetes, and other countless conditions depend on affordable health care to survive. To take that away is to take away their lives. So today, with all of us standing here today, we are calling on all our lawmakers, all our leaders, to everybody to stand up, protect Medicaid, and safeguard health care for all, because let's make this clear: health care is a right, not a privilege. Health care is a right, not a privilege, because no one should ever have to force to choose whether they should live or die. And so I close with the words of the prophet Isaiah, who says this: "Learn to do good, seek justice, rescue the oppressed, defend the orphan, plead for the widow. Let's do our job. Let's stand up. Let's speak up and understand, no matter how many people show up, we are mighty in power and God is with us." Amen. Thank you.
What a powerful story. Thank you so much, Pastor Dennis. Next, we are going to hear from Pastor Dan Streeper from Redeemer Lutheran Church in White Bear Lake.
Thank you, Janae. I'm really grateful to come before you all today from faith traditions all across, from all variety of faith traditions, to stand up against what could be this disastrous federal budget deal. At this time, we're called to lead for such a time as this. And it's morally reprehensible and cruel that at a time when families are struggling to afford and access already broken healthcare systems, some of our elected officials in Congress have chosen to make matters worse for our people, our members, and for all of us in the state. The bill that they passed this summer would kick people off their Medicaid health care and hike up premiums for others, all in order to give this giant tax break to the wealthiest. So do those who voted in support of this budget have any conscience or shame at all? The stakes of this federal budget deal are personally hitting home for me. My son Andrew is on disability because he has Williams syndrome. Recently, the changes and cuts to Medicaid and Medicare have impacted his ability to live independently. His group home has closed and he's had to move home with us across counties, causing him to lose his job and reapply for all his services. With Medicaid Part B now coming out of Social Security disability income, we can't find housing that he can afford. He would be homeless without us right now. And with his higher functioning status, there's a question about whether he'll be required to work more hours than he's capable of to even maintain his medical health care. This terrible bill has also affected many members of my congregation. One woman, an immigrant from Sierra Leone and healthcare worker herself, was diagnosed with cancer this year. Since she's on Medicaid and cannot work during her cancer treatments, she will fall below her new permitted hours and will lose coverage altogether. She's a single mom with a daughter, and this treatment could be the difference between whether she will live or die. Enough is enough, and our faith is clear. Proverbs 14 says, "Those who oppress the poor insult their maker, but those who are kind to the needy honor him." And Christ says in Matthew, "Whenever you do these things to the least of these, you've done them to me." So we're called to see those around us and care for them, and our communities are better and stronger when we do. Congress members, you still have time to do what's right and good for your constituents, but the clock is ticking. I'm urging Congress members and those to join in speaking out against the dangers of this budget bill, moving their colleagues to undo harmful acts to Medicaid and SNAP, and ensure that we're funding our education and protecting basic human decency for immigrants. Thank you.
Thank you, Pastor Dan, for sharing your powerful story. Next, we are going to hear from Imam Ahmed Shaban at the Muslim American Society's Blaine Mosque.
Good morning, all. I am Imam Ahmed Shaban with the Muslim American Society, the Blaine Mosque, and I'm also a leader with the Muslim Coalition of Isaiah. I'm here today because I care about my family, I care about my community, and I care about Minnesotans across the state. Everyone in Minnesota, everyone, across place and background should be able to get health care without going bankrupt. Yes. And to not have to go hungry when we have fallen on hard times. Yes. Our schools and our educators deserve well-funded schools. Yes. And everyone, whether they have called Minnesota home for 20 years or 20 days, yes, should be able to have their civil rights treated with dignity and respect. Yes. But what our federal government is doing right now, when it passed this summer, the bill that it passed this summer is terrible and dangerous for everyone and everyday people. My wife and I, we receive health care through the healthcare exchange, the individual exchange. It is reported that roughly 90,000 Minnesotans are going to have their costs increased by over 50% because of this bill. Minnesotans like myself, Minnesotans like yourselves, show me how making people's health care more expensive beautiful. How is it? What is good about this? Not only that, but we are also concerned about the massive increase to the funding that ICE is receiving. Yes. It will accelerate people, even U.S. citizens, being racially profiled, detained, and disappeared. It is not right. It is alarming. A federal budget that puts tax breaks for the ultra-wealthy over the basic needs of Minnesotans and of Americans is not right for us. It is not what we deserve. As Congress works on reconciling the federal budget, I urge them to do better before the deadline. Before the deadline. Show us you actually care about your constituents. Thank you today.
Thank you, Imam Shaban. And lastly, we are going to hear from Pastor Quinlan Koch of First Lutheran Church in Red Wing, Minnesota.
This conversation about our broken healthcare system is not abstract for me. It's not far away. This is my family. My mother has stage 4 kidney disease. Both of my parents are diabetic, and in 2023, my father broke his back in 3 places after a car accident, requiring his lower spine to be fused. And in October of last year, he was diagnosed with Parkinson's. Because of their decline in health, they have unfortunately lost their jobs. And now just to keep seeing doctors, just to keep receiving the care that they need, they are paying over $1,800 a month out of pocket. Friends, this is breaking them. It's not simply sustainable. It should not be this way. And I know that we are not alone. In the community I serve, I see families and individuals who depend on Medicare and Medicaid every day. And these programs are not luxuries for many. They are lifelines. They mean dignity, hope, and a chance to keep going to my parents and to so many more. I lament that in the richest nation in the world, so many carry this kind of burden, and that some of our Congress members, including 4 who represent our state of Minnesota, would choose to make matters even more difficult for our families already struggling to simply get by. I grieve that Care comes with such a cost. And I pray that our leaders would choose compassion, choose dignity, choose care for the sake of families like mine and for our neighbors.
That's right. That's right. Amen.
Thank you, Pastor. Thank you so much. It is at this time that we welcome questions from the press for any of our speakers.
Senator Smith, what would it take in terms of healthcare changes, Medicaid cuts, premium tax credits, to be a yes vote?
Well, so far be it from me to negotiate with you about exactly how we can make this come together. But let me say really clearly that Senate Democrats are united in not being bullied and intimidated by this administration, and we are ready to work with them to negotiate on a path forward that actually does something to improve health care for my constituents, for Americans everywhere. And last week, Senate Democrats put forth our own bill for how we could move forward. Republicans, actually, it's interesting, our bill got more votes than the Republican proposal did because they couldn't even bother to show up and make their voices heard. So to answer your question directly, I am interested in working together across our differences in order to make improvements to people's health care, but I'm not going to sign a blank check to this administration and to Russell Vought, who just yesterday said that they have a plan to basically fire, huge numbers of federal employees, again, trying to use intimidation to get their way.
No.
Sure.
It seems that Republicans are more amenable to the
Yes.
extension.
Mm-hmm.
Have you spoken to the 10 Republicans that proposed that, for example, year-long extension?
Well, so a year-long extension. So this is the thing that the Republicans are so far refusing to fix, which would be an extension of the buy-down on people's health insurance that they buy through the exchanges so that it remains affordable for people. And if that doesn't happen, we're going to see the kinds of increases in health insurance premiums maybe up to 70% that we're so concerned about. I believe that there is common ground to be found on that issue. But so far, the Republicans are saying basically, oh, trust us. We'll work with you on that later. Yet there is no evidence that they have been willing to negotiate with us at all. So you can understand why it's hard for us to say, oh, we're going to trust you, when yet, time after time, they have just refused to negotiate with us at all. So this is a point where we feel like we have some power to get them to come to the table, and that's what we're trying so hard to do.
Weren't there like 10 Republicans that proposed a bill to extend the tax cuts and just
I've spoken to Republicans who believe that this is the right thing to do, but there's a difference between people willing to say in private or even in a letter that they're willing to negotiate and to come to an agreement on extending these tax credits, and then that actually happening. And we want to see it happen and not just being talked about it. But this should be a place where we could have some optimism, some faith that we could accomplish something if they would come to the table. But unfortunately, they're refusing to even sit down and talk with us. So yesterday, the president and Russell Vought basically threatened that if the government goes into shutdown, that they will lay off, an untold number of federal employees. Basically, that is an intimidation tactic. That is a classic tactic that people use when they're basically saying either do it my way or you're going to end up paying the price. We have given in to their intimidation tactics in the past, and look where we are. So I think it's important now that we stand up to this. Bullies will continue to bully you until you finally say enough. So I am not going to be intimidated by these tactics.
Thank you.
So understand what's happening here. We've had a bumper crop of soybeans in this country. Farmers, family farmers, have put literally their blood, sweat, and tears into this harvest. Yet, because of the Trump tariffs, there is no market in one of our biggest markets China, there is no market for American soybeans. So soybean farmers are facing a devastating loss this year. And this is what this administration does. It messes up our trading relationships, and then it turns around and says, oh, but we're going to bail you out. And that is not what, farmers in Minnesota are looking for. They're looking for free and fair access to their market so they can sell their soybeans and their crops across the globe. So I'm always going to do what I know is going to be best for American farmers, for Minnesota farmers, especially small family farmers who don't have the benefit of any big bailout when things go south for them. And we'll have to see what happens and what the proposals are. But I think the fundamental problem of them basically wrecking our trading relationships on the one hand, and then offering basically a payoff or a bailout on the other hand, is a dead-end strategy. Okay.
Can I ask one of the faith leaders you guys have? I don't know what this question is. How do you plan to support your community if these cuts?
So the question is, how do we plan to support our faith communities in the event that these cuts go through?
Given what control you might have to understand?
Yeah. I mean, the fact that you even have to ask that question shows the massive problem. For too long in this country, we have depended on piecemealing together, cobblestoning together, people of goodwill and good faith to help people out. But the reality is this: for the massive work that we do in this country to make sure that people have food, most of the communities represented here have food pantries and food banks that they're feeding their communities because we have a government currently that is failing to do it. The fact is that our SNAP program, which is our food assistance program here in this country, has been helping us tremendously. And with these cuts, it will be devastatingly cut. For every one meal that all of the faith communities, all of the food banks in this country are providing, SNAP program provides 9. 9. And what we are talking about is a cut from that 9 down to 6. The way in which we've been cobblestoning this together, we cannot make up for those extra 3 meals. We're already struggling with the 1. And it should not be on the backs of the people who are just trying to make it to figure out how to make it some more. When we are in the wealthiest country, it makes 0 sense. And so my question for our Congress people is, what are you going to do? What are you going to do to ensure that this does not happen? People are faith here, we're here, and we're being highly political. And I'm saying political and not partisan. Because the fact of the matter is that there are Republicans who have a good heart, who write great letters, who say things behind closed doors. We need you to do it. We need you to do it today. That is the reality. People will die if this passes as is. And that blood will be on our congressional folks. But we are the ones who have to attend the funerals. We're the ones who have to eulogize people. So please understand that my anger is righteous. I'm here joyfully doing this work because we have to, but I am also here grounded and clear that we can do something, and we should. No one should just stand by and watch and be spectators of our suffering. We can make sure that our country and our state provides for the people right now. Right now. All right. We are so grateful for members of the press, for those who have gathered here today, for all of our clergy and our U.S. Senator for being here. And our call is for every single Minnesotan. Call your congresspeople. Even if you think that they're going to do the right thing, call them, tell them to fight for you, to fight for us. Even if you're not on Medicaid or if you're not on the public exchange, guess what? Your health care will be impacted too. Because last time I checked, health insurance companies are about making money. And when there are far less people on it because they can't afford it, they send their prices upward, not down. So your employer-based insurance will go up as well. Do not be fooled. Do not have folks setting adding fuel to a dumpster fire, telling you it's beautiful, and believing that's okay. That kind of spin doesn't work over here. And in Minnesota, we know better. We're going to take care of each other. And so we need you to make sure that you're taking care of us, and we're going to take care of you. Call your Congress people today. Thank you. Thank you.